everyone, welcome to Scripts in Science. So today we are going to do a renal failure quiz. So get ready to test your knowledge about kidney health, and if you find this video useful, comment below with your answers and like and share this video with your friends and colleagues. So without wasting time, let's get started. First question is reason behind edema in nephrotic syndrome. First one is proteinuria, hematuria, hypoalbuminemia and hyperlipidemia. Just pause this video for a few seconds and reply in the comment section. We should know a little bit about nephrotic syndrome. What is nephrotic syndrome? Nephrotic syndrome is when our body excrete excess amount of proteins in the urine. Actually, what happens normally when we see the normal physiology, we have a filtering unit in the kidney, that is the nephron, and in the nephron we have the filter, that is glomerulus. In the glomerulus we have tiny capillaries, right? And whenever there is a damage to these capillaries, then this problem clears. Normally these capillaries filter the waste, excess amount of water and minerals from the body but they are not excreting the large molecules like proteins and RBCs, right? But when there's a damage to these capillaries, the excess amount of proteins are also excreted through these capillaries, right? So there's a problem at the glomerulus. There's a damage at the capillaries, right? And when this passes through from the capillaries to the tubules, the water, minerals and the nutrients that are excreted, that is filtered out from that capillaries, then is again reabsorbed in the tubules. Only the water and the waste material forms the urine, right? So, and now first is the protein and second is hypoalbuminemia. Hypoalbuminemia is whenever there is less plasma protein. Plasma proteins are albumin. Albumin is the plasma protein that is synthesized by the liver, and that is responsible for the oncotic pressure in the blood, right? Now next we have hematuria. In some of the cases we see hematuria also because any inflammation or any injury. And another is the hyperlipidemia, hypertriglyceridemia. We have hyperlipidemia because of this the liver produces more cholesterol, more fatty acids, more triglycerides, and the patient is having hyperlipidemia. This there. Now answer of this question is exactly, I'm confused with the A and the C part, right? We have, but if you think about this from A and C, the hypoalbuminemia is also maybe the cause of edema, and proteinuria is also but exact cause it is hypoalbumin. Because of the albumin content is less in the blood, because of that there is the edema. So the straight answer is we have hypoalbuminemia, that is C. We have C is the answer of this question, right? Now is furosemide acts on which part of the nephron? It's proximal and distal tubule, descending loop of Henle, ascending loop of Henle. So just pause this video for some time and comment it. For doing the answers of this question, we should know something about furosemide. Furosemide is a loop diuretic and another name is Lasix, right? We are giving injection Lasix to the patient of, like, we have, if there is a kidney disease, the patient is having any problem with the kidney, we are giving in most of the cases the Lasix, the loop diuretics, right? Where does it act? It acts on the ascending loop of Henle, and what it does, it excretes the sodium, potassium and water from the ascending loop of Henle and inhibit the reabsorption of sodium, potassium. It helps in those conditions. Why? Because already there is water and the waste materials and a lot of things are accumulated inside the body. So we want to excrete, we want to remove these water or excess waste from the body. So here it acts by inhibit the reabsorption of sodium and potassium. So the answer would be descending loop of Henle. Okay. Now, patient with CKD needs to avoid banana, green leafy vegetables, yogurt, and all of these. We know that in CKD patients or chronic kidney disease patient, we have to be mindful of the fact that we should not eat high potassium, high phosphorus, high sodium. We should avoid all the things which has high potassium, high sodium and high phosphorus, right? But we have to take high protein diet. But from all these options, we have three options. All these options, in banana we have high potassium, right? In green leafy vegetables also we have high potassium, and in yogurt is also a rich source of potassium and phosphorus, but it is also the higher source of protein. If we are taking low fat yogurt, then it is good, but here there is no clarification about this, so we are just taking it as a yogurt. So all of these things, they have high potassium and high phosphorus, so we are avoiding these in chronic kidney disease patients, right? So the correct answer will be D. All of these we should avoid in CKD patients, right? So thank you so much for this video. If you like this video, please hit the like button and share with your friends and challenge them. I'll keep doing this video for few days. If you like this video, I'll keep doing these type of series, and all the best for you.